presenting a new series, Medically Verbal, where we'll solve case history in just a couple of minutes. Disclaimer: these case studies are for understanding purposes. Inaccuracies may be present. Do not attempt these processes without the guidance of a licensed medical professional. Case 10. Chief complaint. A 50-year-old female presents to the clinic with fatigue, weight gain, and cold intolerance. History of present illness. The patient reports feeling increasingly fatigued over the past 6 months. She has gained about 15 pounds despite no significant changes in her diet or physical activity. She also notes that she feels cold more often than usual and has dry skin and hair loss. She denies chest pain, shortness of breath, or changes in bowel habits. Past medical history: hypertension, hyperlipidemia. She is currently on amlodipine for hypertension and atorvastatin for hyperlipidemia. She doesn't smoke, drinks alcohol occasionally, works as a teacher, and has no recreational drug use. Mother had hypothyroidism. Father has type 2 diabetes. Physical examination shows BP 135 systolic, 85 diastolic, heart rate 60, respiratory rate 16, temperature 97. Her skin is dry and cool. She's facing problems with her hair where they are becoming thin, dry, and brittle. Does not present with any palpable thyroid enlargement or nodules. Has regular rhythm and no murmurs in the cardiovascular region. Respiratory region is clear to auscultation bilaterally. Abdominal region is soft and does not present with any tenderness. Her extremities does not have edema, but it does show delayed deep tendon reflexes. What are deep tendon reflexes? Involuntary, unlearned reflexes which are used to check the motor activity of the tendon. Common ones are the knee-jerk reflex, the Achilles tendon reflex. Initial differential diagnosis: hypothyroidism, anemia, chronic fatigue syndrome, depression, Cushing's syndrome. Based on this presentation, what do you think is the most likely diagnosis, and what further investigations or management steps would you consider? If you're thinking hypothyroidism, then it is the right answer because of the patient's symptom and history. How are we going to confirm this out? There are a lot of supporting features, and we're talking about cold intolerance. Why is it so typical in hypothyroidism? Because thyroxine is responsible for maintaining the BMR of the body. Once the BMR is decreased, the heat that is produced from the BMR is also decreased in amount. At the same time, low levels of thyroxine hormone causes vasoconstriction, which could lead to us feeling cold at even warm places. And our heart rate is 60, which is a sign of bradycardia. Again, it is a symptom of hypothyroidism. So the investigations which we will do is TSH, which is elevated, free T3, free T4, which is low. Thyroid antibodies to check whether the body is attacking its own thyroid gland or not. So we'll perform an anti-TPO and an anti-TG, which is thyroglobulin antibodies. We'll do a CBC because anemia can coexist with hypothyroidism. Why exactly? Thyroid hormone stimulates the synthesis of erythropoietin. Less of thyroxine, less of erythropoiesis. Lipid profile: hypothyroidism can cause lipidemia. Of course, the BMR has decreased. Management: we'll start with thyroid hormone replacement by giving her levothyroxine. The dosage would be based on the weight and the severity, and it would be adjusted according to the TSH levels on the follow-ups. Every 6 to 8 weeks, we'll monitor her TSH levels, and eventually we'll see how the symptoms are improving, and accordingly we'll see how the symptoms are getting obliterated. Lifestyle and dietary recommendations would be a healthy diet and regular exercise so that she could manage her weight gain, At the same time, we would ask her to avoid excessive iodine. Why are we saying so? Because when we are giving them too much iodine now, that could actually worsen the thyroid dysfunction. Hope you like the case study of today. You can come back whenever you want to sum it up. Please make sure that this is not a substitute of medical advice and is just for understanding purposes of how to diagnose and solve case histories. Corrections or suggestions, comment down below. Make sure to like, share, subscribe, and hit the bell icon to never miss another update.